Good morning and welcome back to GP Video Podcast by Nadia. So today we will be talking about antidepressants and dementia. What is the connection between antidepressants and dementia? We have already said a lot of times about it that several studies have now established that depression at any age doubles the chances of getting demented at later age. So people who have depression at any age, especially in the midlife, have double the chances of getting demented at later age as compared to people who do not suffer from depression. But again, people who treat their depression with antidepressants and therapy reduce their chances of getting demented by around 30%. So antidepressants play an important role in preventing dementia if people suffer from depression. So there was a myth as well at some stage that people who use antidepressants can get demented, but that is not true. Actually, the reverse is true. Antidepressants are not associated with an increased risk for dementia, accelerated cognitive decline, or atrophy of white and gray matter in adults with no signs of cognitive impairment, new research suggests. So the myth that antidepressants are associated with accelerated cognitive decline, atrophy of white and gray matter, which are the parts of brain with no signs of cognitive impairment, there is no reality, there is no truth to that. In fact, people who suffer from depression and treat their depression with antidepressants reduce their chances of getting demented by around 30%. Otherwise, people who suffer from depression have double the chances of getting demented at later age. Now, that is something which is before dementia. Now, people who are demented and also suffer from depression, what is the goal for using antidepressants in them? Antidepressant use in demented people is important for increased quality of life if they are diagnosed with depression. So demented people with dementia who are diagnosed with depression, use of antidepressant in such people is important for increased quality of life. People with dementia of any type have a higher incidence of major depression. So people with dementia are at increased risk of getting depressed. The occurrence of a first major depressive episode in an older adult is a risk factor for developing dementia. So again, as I had already said, that people who suffer from depression at middle age and older age, they are actually at increased risk of getting demented at later age of life. Management of depression in a person with dementia should be enthusiastic, should be proactive, with an aim to optimize quality of life. Because in people with dementia, quality of life is very, very important. And whatever we can do to improve the quality of their lives is really important. So other medications, they can be, because I am of that theory that people who are more than 70 to 75 years of age, polypharmacy should be reduced in them. The lesser the tablets, the better it is for them. But the use of antidepressants is very important in demented people to improve the quality of their life. In people with dementia, who are more than 70 to 75 years of age, what matters most is the quality of life. Anything that can improve their quality of life, be it a medicine, food, activity, that should be applied for them. So there are so many medications, for example, treating their high cholesterol or treating their, let's say, B12 deficiency. They are also important, but if they are not associated with an increased quality of life, and if they are not that important, if they are not that crucial, if vitamin B12 deficiency is not that great, or if their cholesterol is not that high, and they are not very keen on taking tablets, then we should just let them go. But if they suffer from depression, then to improve the quality of their life, it is important to use antidepressants. Non-pharmacological and pharmacological strategies are both important in treating depression in dementia, and management of these patients requires a collaborative approach. So not only non-pharmacological and behavioral therapies, but pharmacological treatment together with non-pharmacological treatment is very, very important. Selective serotonin reuptake inhibitors, which are SSRIs, are the first-line pharmacotherapy for depression and dementia, although they could be less likely to be effective in older people. People with dementia of any type, whether it's vascular, whether it's Alzheimer's, whether it's Lewy body dementia, whatever dementia it is, they have a higher incidence of major depression. We'll get back to underdiagnosis of type 2 diabetes mellitus in tomorrow's video podcast. See you guys. Have a great Monday.